Hi, my name is Rayan. I oversee our housing department here at Volunteers of America, which means I oversee our leasing department, our maintenance department, and then our permanent supportive housing program. All of these folks serve about 185 chronically homeless individuals in their own independent housing, and most of the folks have been homeless for about an average of 10 years prior to getting with us, and they commonly have 3 or more conditions, and about 85 to 90% identify as at least having a mental illness. So those folks are all supported by really intensive case management and help them work through anything that's necessary to get them stable in housing, because often they've learned a ton of skills that make them successful on the streets, and they have to relearn or adapt into housing. And so we work from a harm reduction, housing first approach, which means we believe every person deserves housing, and there should be no steps or anything like that to be able to qualify for that. So we take who the city identifies as the most vulnerable chronically homeless individual in Spokane. We put them in an apartment, and then we start loving on them, giving them all the care that they need, the support services that we can. We work with community providers with mental health and substance use. We also work with our local medical centers to be able to make sure that they get the right care. We provide leasing to them, so I act as their landlord. They learn everything, just as any other renter in Spokane would, about what it takes to be a good neighbor, what a lease means, what are all the addendums, how do you learn how to live in an apartment setting. And then our maintenance team, of course, takes care of all the regular maintenance, and then our maintenance also helps with any of our other programs in Volunteers of America, so they serve agency-wide. But overall, the team really works together to make sure our tenants are supported, they know their rights, and they know their responsibilities, and then we just work together to see folks be able to get stable and either move out or stay with us for as long as they'd like. So we are really intensive case management. So we're in their apartments, we see them all the time, we really work a lot with folks, and so COVID really hit, and we wanted to make sure that our most vulnerable folks, that we weren't the reason that they were getting sick. And so we really had to balance between making sure they don't get sick and knowing that the likelihood is I'm the only one who's gonna see them in the next 2-3 months. And if I don't see them, something could happen, they could pass away and nobody would know. So we really tried to balance those priorities. We adjusted case management to do as much as we could by phone, keeping our distance, meeting somewhere that was open space. And then our case management really adjusted into kind of this superhero cleaning crew. So they clean all of our buildings 3 times a day. They even come in on Saturdays and Sundays. They do all of this while still maintaining their regular job duties and taking care of our folks. So it's been a little bit of an adjustment because we for the most part, we're all huggers. We love to take care of one another. We love to be together, building those relationships and those community partners. We also offer community meals and community engagement events, and we celebrate monthly birthdays, and we do bingo, and we just have fun together. And all of those events have been canceled because we can't hold that many folks all together. So our community engagement has taken quite a bit of a hit, and our case management has had to adjust quite a bit, and we're cleaning a lot. But for the most part, our services have stayed the same. We just had to really kind of learn and adapt. But in our adult program, we really prioritize still being able to make eye contact with some folks. Mm-hmm. So the folks who we've moved in have been about 10. We just moved someone in yesterday since January, so that has been cool. We never slowed down. We really prioritize. We're gonna keep getting people in here and getting them off the streets, because nobody needs to be on the streets during this COVID outbreak. We know that it's really hard in shelters to maintain that space, so we wanted to make sure that folks are able to get in and secure housing. We've had 6 people move out successfully onto their own permanent housing. 2 of those increased their income so much that they didn't qualify for any housing subsidies, so that's been pretty cool. And then unfortunately we've had 2 people pass away since January, so thankfully they were able to pass with us, pass in their home, and we've been working with the families to make sure that their final wishes are taken care of. I think the last thing is just that we appreciate every dollar that we get. Permanent supportive housing in and of itself doesn't get a ton of donors, and so when we do an annual campaign like this is where we get most of our dollars, and these dollars go to, just last week I bought and earned for somebody because their family member died and they just could not afford it. And so some of the money goes to that. Some of the money goes to application fees to get people when they're ready to move out and they want to free up a bed for someone else. I pay for application fees. I help them find money for deposits. This money is really important, and while the housing side is typically funded, all of those extra things that we usually take for granted for, I'm able to just go out and buy some cleaning supplies when I gotta do something, and these folks aren't really able to do that. We house a lot of folks who have zero income or 197, and they do their best to manage, and sometimes, the easiest thing is their dog not being fixed or having some issues is gonna get them kicked out. Well, VOA is going to say, we're going to do the best we can to find money to pay for that, so that you don't lose your housing over that. So it's an easy fix, and donors are so important in that process. We have a lot of donors who donate food, who donate bingo prizes, who do that stuff, and community engagement is probably the number one reason why people stay housed. They feel protected in their community. They feel like they belong somewhere. They're not getting kicked out every time they sit down. And so those events and those things that donors and community partners participate in are absolutely the reason why we're able to be successful in what we do. Our community partners never let us down. We're really tight with a lot of folks, and we know that it takes a village, right? And I'm able to provide housing, but I can't provide everything. And so when we get a donor, we get a community partner in to donate some stuff, we tell clients exactly where that money comes from. They understand that their community cares about them, and they understand that somebody donated money to take care of them. So I think just kind of the whole circle of life, right? Some of us are able to give, and some are able to give money and time and things like that. And so I want you to know that we really appreciate every single dollar that's donated, and we love it, and we feel the love when you donate your time or your money, or even just your knowledge. We really appreciate it.